right, no matter how much you diet or how much weight you lose, it's one of the hardest areas to lose that jiggle in your body.
We're talking about that double chin, but now there's hope in a new FDA-approved treatment for neck fat. It's called, is it Kybella, doctor? Kybella. It's a series of small injections that destroy fat cells.
All right, 2 patients are about to get the procedure right now.
Yes,
with
so if you're
board
squeamish.
certified plastic surgeon Brian Glad and the assistance of nurse Caitlin Pa.
One of those patients is this gentleman, 35-year-old Peter On. About 3 months ago, Peter decided he wanted to lose weight. Father of 2 has dropped almost 20 pounds. Good for you. But he says the pockets of fat under his chin haven't budged. So he's decided it's time to try a different way to slim his chin. And welcome to everybody.
Hey, welcome. All right, this is really happening right now, huh?
It's really happening.
Okay, so Peter, why is he a good client or patient for this type of procedure?
Well, is the perfect person for this kind of procedure. He's relatively fit, he's been dieting, he's been exercising, and he cannot get rid of the fat underneath his neck.
Is it genetic a lot always, or
it's
sometimes?
Not always genetic, but you like to think that someone is somewhat optimized. They've tried diet, they've tried exercise, and it's somewhat of a last option, similar to liposuction.
All right, so you've numbed him up, and how many sessions is he going to need?
At least 2. Usually up to 4, most.
So what happens? You're injecting what? Like, what's going on here?
The Kybella is made out of something called deoxycholic acid, fancy word. It's basically a natural molecule that we already have in our body that dissolves fat. And so when you inject it, the agent itself is actually dissolving his fat, destroying the fat cells so that they can't reaccumulate fat.
And it goes out through your lymphatic system?
Correct, excreted through your system. And what's really interesting is the results last despite weight gain over the years.
Oh,
so you won't need to do it again?
You will not need to do it again.
Okay, so you're going to do it right now?
I'm going to do it right now.
Okay.
And people need to know how much it costs, because that's
yeah, how much is it?
It varies around the country, we know.
It varies around the country, somewhere probably between $1,200 to $2,000 a treatment,
wow.
which probably adds up all in somewhat less than what it would be for liposuction without the recovery that you'd get from surgery.
If someone wanted to use this exact system somewhere else on their body, does it work, or is it just for your chin?
It's not FDA approved for that.
Great question. It's not FDA approved for that. Would it work? It probably would work. There are some nuances where it may not be able to be used in some areas, and it hasn't been formally investigated in that way yet.
Okay. So as you're injecting, there are some things there are some drawbacks, obviously. Nothing is without risk. What are some of the risks?
The risks for Kybella are very minor, actually. It's usually some swelling, possibly some redness, could be some bruising, although the local anesthesia does help that. It constricts the blood vessels.
Are you nervous?
Well,
only because I'm on TV.
You can hold.
Okay. Oh, look at you on TV. Okay, tell us if it hurts. I can't look, so I don't like looking at
You tell me when.
I like to look.
So Pete's all numbed up.
I don't want you
what we do is
looking.
we place a series of dots here, okay, before I start.
Are you feeling it, Peter?
I don't feel anything.
Oh, good.
Doesn't feel anything.
Can you feel me squeezing your hand?
I can feel that.
Okay.
And as I move along, I'm putting a little bit into each segment. Now, I'm actually not going through the dot because I would not want to place a tattoo into his neck.
Okay.
Sorry, is that enough?
I can't
let
look.
the doctor do
You guys
his
aren't
job.
gonna go
I know.
down.
I just don't want to faint, so I'm looking over.
Oh,
here.
it's dribbling just a tad.
There's no blood. There's no blood. He's doing
Oh, that's
great.
unfortunate.
Okay.
All right, Kate, I'll take one more.
Oh, you're doing another one?
Well, there's
I can
more
stop.
little bumps.
Yeah,
No,
I can get rid of that.
No, keep
He's
going,
paying-
because
Pete wants to get rid of it. So here we go. So it's pretty quick. It's pretty
It's almost
easy.
done, Pete.
It's almost done.
You
Oh, my
hang in there. You
God,
only have to
you're
go
doing
through this
good.
3 more times.
Hopefully just once. I mean, Pete's neck is a little bit more full. So he may have one more after that. I'm good.
He's
We're all
darn
set.
good looking, though.
All right. So we're gonna talk about our next patient. This is important. 53-year-old mother of 2, Marie Singer. She said she's always been health conscious and she exercises regularly, but her double chin was bothering her. So when her husband Dave threw her surprise 50th birthday party, she said the photos didn't match the way she felt.
Yeah.
So she works in Dr. Glatt's office 2 days a week, providing skincare services for his patients. And look who just now is in the chair.
Isn't that amazing?
Hi.
Peter's just fine. And
Peter's fine. Yeah, and he's actually even taking pictures. Okay, he's
Now,
good.
Marie, did it hurt you when you went through the first time?
No, I have to tell you, I felt very little of anything, just the initial injection for the numbing.
Yeah.
By the way, you can already see a difference. I'm sorry, but I was just looking at the earlier
I know.
pictures of you.
6
Do you
weeks.
feel it? You feel the difference?
I do, and I love it.
Okay, so this is her second procedure.
Her second procedure. You're going to have to bring us back in 6 weeks.
Yes.
We are, and you feel really good? You could feel the difference right away?
I feel great, yep.
Did anything weird happen to you after? Did you?
Nothing, a little tingling, a little numbness for about 2 or 3 days.
And you
And
went
that
out
was it.
And I went out with my day. I went back to work.
You can go, so you can go back to work right after this.
You are a little swollen.
Okay.
Yeah.
And do you just ice it and it goes away?
Yeah.
This is unbelievable.
I know. I like the fact that it's a natural and already found in your system.
You can come over here. Come on over. We don't want to leave you out.
So we're not
going to do that here, but thank you so much.
He's going to do
we really
it for
appreciate
her here,
it.
though, right?
In the commercial.
Yeah, in the commercial.
All right.
Thank you all very much. And Pete, you were a champ. You were a champ.
You're awesome.
So we want to check back in with Peter and Marie, who got Kybella injections to remove extra chin fat. They're going to be back in a couple of weeks.
What about these two ladies?
We need it. I need it. And we don't have the money for it. They won't pay for it. So can you say that? Can